Welcome to the Clear Ground Show. I'm your host, Dr. G, with a PhD. So since we last talked on Wednesday, a whole bunch of COVID news has broken, and we're here to talk all about it. So we're going to talk a lot about COVID lockdowns popping up all over the place in Europe, from Czech Republic to Ireland to Germany to Greece to Italy and more. We're then going to move over to the US, where we're going to be discussing a whole bunch of topics, including vaccination definition changes, what Fauci thinks on hospitalization rates, workers losing their work over COVID vaccination, OSHA and what's happening with that mandate, and much more in the US. And finally, we're going to wrap it up with a small segment on climate change after some announcements made by Chuck Schumer. And with that, let's dive on in. On Wednesday, we discussed Austria's practice of locking down the unvaccinated as their COVID cases were rising. As the chancellor in Austria said, his prime motivation was, with these lockdowns that is, was to get the unvaccinated vaccinated. Well, since Wednesday, much of Europe has followed in Austria's wake, and we're going to see what that means. We're going to break down the stats for you guys right now. Let's start with the Czech Republic and Slovakia, and this article comes from Reuters. Both countries announced Wednesday that they're putting tight restrictions on people who have not had the COVID-19 shot, specifically mentioning Austria and Europe as their sort of inspiration for these lockdown measures. So the Czech government is planning to allow only those who are vaccinated or have recovered from COVID-19 in the past 6 months to partake in various daily activities. Now, as a brief aside, the 6-month number is kind of interesting. As we saw in the Swedish study, vaccinations typically wane at the 6-month number for both the mRNA Pfizer and Moderna vaccinations. But for naturally acquired immunity, I'm not entirely sure where they're getting the 6-month cutoff point. Like Austria, the Czech health minister said, and I'm quoting, "The main goal of these measures is motivation for vaccinations." With the Prime Minister of Slovakia taking a further step, saying this is a lockdown for the unvaccinated. So let's briefly take a look at the Czech Republic stats, and this is coming from the Reuters World Health COVID tracker. The Czech Republic currently is at 97% of their highest peak, and they're on the rise. They're sitting at 823 infections per 100,000 people, and that's the average over the last 7 days. As for their vaccination rate, they're sitting at around 60.4% of the country's population fully vaccinated. Now let's take a look at Ireland, and this article comes from the Irish Mirror. Now, although Ireland is seeing an uptick in cases, they don't yet want to implement full lockdowns. They are, however, going to implement 5 new rules. Those rules are as follows. Pubs, restaurants, and nightclubs will have a new closing time of midnight starting Thursday. People will have to restrict their movements for 5 days if they are a household contact and will have to take 3 antigen tests in a new policy change. People will be told to work from home, which NPHET have recommended. Vaccine passes will be required to access theaters and cinemas, but not at hairdressers, barbers, or gyms. Strict rules around mask wearing for indoor and outdoor settings are going to be put in place. Now, a couple of these definitely seem pretty arbitrary. For one, I'm not entirely sure the difference between midnight and 2 a.m., for example. Like, is the virus more active then? I don't really understand the closing time if they're going to be open the rest of the time. I also don't really fully understand that the vaccine passes are going to be required in certain settings versus others. For example, in theaters, it would be really easy to make a social distancing setup. You just put like a cone in between each seat or every other seat. But at hairdressers and barbers and gyms, that's usually a close contact situation by necessity in some places, especially like hairdressers. So I'm not entirely sure why the vaccine passes are required in places that are really easy to implement social distancing rules versus places that are by necessity not socially distant. Now let's look at cases in Ireland. They're at 68% of their highest peak, and they're rising, and they're sitting at 630 infections per 100,000 people, and that's the average over the last 7 days. Now, as for vaccination status, Ireland has approximately 74.6% of their population fully vaccinated, with approximately 93% of their adult population fully vaccinated.
Our sole priority is to ensure that our health service does not become overwhelmed. As a society, we need to look out for each other. 93% of the adult population are fully vaccinated. We have over 600 people in hospital at the moment, and roughly around half of those are unvaccinated. The evidence is absolutely...
Moving over to Germany, this article coming from the BBC, Germany plans to place tighter curbs on the unvaccinated. With Angela Merkel describing the situation of COVID as dramatic in the country and needing to quickly apply the brakes to this rise, the number of daily cases in Germany is at 65,000, or more than 65,000, which is by far the highest since the pandemic began. So Germany is kind of applying a tiered approach to the lockdown, and we'll look at the new rules now. So the new rules state that in areas with a hospitalization rate of more than 3 COVID patients per 100,000 over the last 7 days, only the vaccinated or those who have recovered, and in this particular case, they don't announce a sort of timeline, so it's not like the Czech Republic where it's 6 months. Anyways, those who have recovered from the virus will be allowed to access public spaces like sporting events, cultural shows, and restaurants. So the majority of the country's states currently exceed that threshold. Now, areas with a hospitalization rate of more than 6 in 100,000 are going to have to do the 2G plus rules, which are the same ones that are in place in places like Austria. Those places are going to require people to be testing as well as be vaccinated, and regions that have a rate of more than 9 in 100,000 are going to have to introduce further measures such as restrictions on contact. One kind of eerie quote from Olaf Scholz, who is the finance minister and the chancellor to be in Germany, said, quote, "To get through the winter, we will see drastic measures that have not been taken before." Now, without actually hearing the chancellor to be saying this quote, so you can get the kind of connotations, it seems pretty ominous to me, and it seems like the Germans are going to have a rough go of it this winter, like most of Europe. Now let's look at cases in Germany. Like we said at the beginning, they're at their peak and they are rising. So Germany is sitting right now at 377 cases per 100,000 people, and that's the 7-day average. Looking at vaccinations, Germany seems to have vaccinated around 69.9% of their population. Now let's take a look at Greece, who has had a bit of a roller coaster over the last 3 days in terms of headlines. So on Tuesday, the Prime Minister of Greece, Kyriakos Mitsotakis, in an interview on the British channel ITV, said Greece will not follow the example of Austria and order the unvaccinated to go into lockdown. Now fast forward 2 days to November 18th, Greece is imposing further restrictions on the unvaccinated. You hate to see it sometimes, folks, but let's see what they have to say. So this is according to Reuters. So Greece joins several European countries on Thursday to impose more restrictions on the unvaccinated. Starting next Monday, the unvaccinated will be barred from indoor spaces including restaurants, cinemas, museums, and gyms, even if they test negative for COVID-19. This is a pretty amazing statement. So even if you're otherwise completely healthy, you cannot participate in normal society. Ostensibly, the Greek government is probably saying, hey, we're protecting you, unvaccinated person, from, I guess, other unvaccinated people that test negative. I'm not entirely sure really what's happening or really the motivations behind that particular action. It just really makes no sense. That being said, Mitsotakis said this is indeed a pandemic of the unvaccinated. Some countries can call it a pandemic of the unvaccinated. Others can't, such as Gibraltar, where basically 100% of the population is vaccinated, and they're seeing a rise of cases that reaches 51% of the highest peak they saw in the pandemic, and it's rising right now, with cases at 1,341 per 100,000 people, and that's the average over the last 7 days. But let's look at Greece. Greece is sitting at 97% of the highest peak they saw in the pandemic, and they're at 429 infections per 100,000 people, and that's the average over the last 7 days. As for vaccination rate, Greece is sitting at about 62.6% of the country's population that's vaccinated. And finally, for European countries considering lockdowns, we'll look at Italy, and this comes from the Daily Mail. So Italy is indeed seeing a rise in cases, and the governor of one of the northern states in Italy said, and I quote, "Eventual new lockdowns should not have to be suffered by those who are vaccinated. Restrictions should only apply to those who are not immunized." So currently a total of up to 5 Italian governors are urging the government to impose the same rules as Austria. Now, as for cases, Italy is at 24% of their highest peak during the pandemic, and they're sitting at a case infection rate of 96 cases per 100,000 people, and that's an average over the last 7 days. Now, for vaccination, Italy is sitting at about 76.9% of the country fully vaccinated. And just to briefly compare 2 other countries to Europe that are not doing those kind of lockdowns, we have Sweden that is in Europe, and they're at 12% of their highest peak, and they're sitting at 59 infections per 100,000, and that's over the last 7 days. Now, Sweden has a vaccination rate of 73.4%, fully vaccinated for the entire population. Now, the United States is at 36% of its highest peak during the pandemic, and they're at 191 cases per 100,000, and that's an average over the last 7 days. The United States has vaccinated approximately 67.8% of their population. Now, we already know that vaccination doesn't 100% prevent spread, right? So just because there's vaccinations, that doesn't mean you're not going to have cases. But according to how these sort of chancellors and leaders in Europe are talking, they're basically saying everyone needs to get vaccinated, and the higher the vaccination rate, the lower the case count. So you would expect to see a trend. Well, just for you guys, I made a couple of charts. These charts are going to show vaccination rate, and I did it by increasing vaccination percentage. So the lowest is on the left, the highest is on the right. So you would expect the cases to be the opposite, right? You'd expect the highest number of cases in the lowest vaccinated country and the lowest number of cases in the highest vaccinated country. Now, Gibraltar is kind of an outlier, and it's in there because we talked about it. But if you look at the rest of them, it's kind of all over the place. There's no real predictive pattern between vaccination status and cases. And just because Gibraltar is kind of an outlier, here's how they look without Gibraltar. So if you're in the US and you're wondering, hey, could this possibly happen to us, this kind of lockdown situation? Well, there are some signs saying yes and others indicating no. Let's break down some of those right now. Now, for cause of concern, we're going to go over two topics. One, Dr. Fauci, and the other, Dr. Walensky. So Dr. Fauci has been the de facto COVID king for the US and has been in charge of lots of COVID policy. And when I say in charge of, I mean he's suggested a lot of policy, and those policy suggestions have come to pass. In a story from NBC on November 17th, hospitalizations are rising among fully vaccinated in the US, Dr. Fauci says, and now we're quoting, "What we are starting to see now is an uptick in hospitalizations among people who've been vaccinated but not boosted." So according to this article, the cases of COVID-19 are rising throughout the US, and the health officials are warning that there's an increasing number of fully vaccinated people that are being hospitalized and going to the emergency room. Now, Dr. Walensky is quoted as saying, "The rate of disease is markedly lower for those who receive their booster shot, demonstrating that our boosters are working." This is kind of a hard statement to square with the fact that a couple of paragraphs down, the article cites that it's still not clear how many breakthrough hospitalizations there are. Although CDC has been tracking the rate of hospitalizations among fully vaccinated people, its website shows data only through August 28th. According to the latest data from the CDC, an unvaccinated person is at 11 times greater risk of dying from COVID than a vaccinated person. That was at August 28th, the peak of Delta. The CDC didn't respond to a request for new numbers. So this NBC article dovetails perfectly with a CNN article posted the same day saying the definition of, quote, fully vaccinated is changing to 3 COVID-19 doses. Now, this globe-trotting CNN article goes on to cite UK Prime Minister Boris Johnson saying, and here I'm quoting, "It's very clear that getting 3 jabs, getting your booster, will become an important fact, and it will make life easier for you in all sorts of ways." Silly me, I was under the impression vaccines were specifically for helping fight off disease. Now, what Boris Johnson is saying here is that we have these restrictions, and if you get the vaccine, then your whole life gets a lot easier. So it's not just vaccinate for health, it's vaccinate for health, and then we'll let you do other things. Now, in a splash of refreshing honesty, the CNN article towards the end quotes a doctor by the name of David Nabarro, who's a WHO special envoy for COVID-19. And he basically says, "With so much yet to be learned about the virus, using vaccines as the main weapon against COVID-19 could lead to new variants." Now, it's very rare that science is ever completely settled, but in this case, it most certainly is not, and Dr. Nabarro is expressing honest inquiry through the scientific method, and it should be up for debate, and it should be debated within the scientific community, and there should be experiments tackling all sorts of things with COVID, instead of this sort of unilateral direction we're getting from Dr. Fauci, for example. And finally, for the cherry on top of this side of the argument, saying that the US may be headed towards a European lockdown, is Dr. Walensky saying one of the best things you can get for Christmas is the shot.
What's the best gift to give this year? Consider the gift of health. It's priceless. As we head into the holiday and winter season, now is the time to think about protection for ourselves and our families. So many of us missed being with our friends and family last year. For those who are at higher risk of severe illness from COVID-19 and who are eligible for a COVID-19 booster dose, go out now and get your extra booster dose to protect you. And for those who are not yet vaccinated, including our children, teens, and adolescents who are now all eligible for vaccination, getting vaccinated this week will set you up to being fully protected in time for the holidays and by the end of the year.
So quick point addressing that video before we move on to the why I think we might not go to the lockdown method. Dr. Walensky here just said if you start your vaccination series right now, you'll have both vaccines in you by Christmas. You'll be able to celebrate with your family fully vaccinated. If the definition doesn't change, if the definition changes to 3 vaccines or a booster vaccine, it's not really clear on how they're doing this wording. So you might not be fully vaccinated. So we'll see on that. But now on to why I think we might not be going the lockdown route. In relatively breaking news, OSHA has actually suspended activities related to the implementation and enforcement of the emergency temporary standard, which is what they were using to sort of force employers with over 100 employees to mandate vaccination or mandate testing. So this is a huge blow to the vaccination mandate situation for the US and ultimately for the lockdown the unvaccinated versus vaccinated problem we might run into. And that's because now, if you're an employer with 100 employees, you don't have to vaccinate your employees. Now, this is strictly for private enterprise. The federal government still has that mandate, and that mandate, as far as I know, is still to be completed by November 22nd. But how long can such a mandate last, especially in cities? Let's take a look at New York, for example. So this is according to ABC News. Several dozen New York City sanitation workers have been accused of submitting falsified vaccination cards to satisfy the COVID-19 vaccine mandate for federal workers. Now, Sanitation Department spokesman Josh Goodman said that getting vaccinated is important to public health and we do not tolerate anyone faking something that is a requirement of city employment. Following through by saying anyone found to have faked their vaccination will be suspended without pay. So as of now, the accused sanitation workers face up to 3 weeks of suspension without pay. This is not good for the city, and there's most likely going to be a breaking point where the city says, okay, you know what, fine, we'll at least allow for testing and work or something like that, some accommodation, instead of just a hard line mandate rule. Now, that was a lot of COVID news, so I'll save the new variant stuff for next week. But I want to touch on this story about climate change, and it's a really short video, but I want to discuss some of the implications of it and briefly discuss some climate change overviewing themes with you guys before we head out for the weekend.
Last year with COVID was awful. But in a few years, because of climate change, each year will be worse than COVID, and each year will be worse than the next if we don't do anything about it.
So a lot of people have said this was coming, and it's pretty obvious if you just follow the pattern here. They're saying climate change is an emergency, and so we should invoke these sort of emergency rules that we've been using with COVID to address climate change. Now, climate change is definitely a loaded word because it's very clear to anyone that understands the basic Earth history that the Earth has gone through several types of climates. We've had ice ages, we've had warm ages with no ice, and everything in between. So when he says do something about it, that's also kind of a nebulous term. I'm not entirely sure where he wants to go with it. Does he want to prevent the climate from changing ever? Maybe he wants it to warm just a little bit so that we get more plants sprouting up in different environments in the Earth. Maybe he wants to cool down a little bit. It's really hard to tell, but just like these COVID policies, there's never an achievable metric. There's never like a hard number to where we say, yeah, we did it. We climate change has been prevented. Now, if he's referring to each year being worse, each successive year being worse than COVID, and he's referring to that in terms of deaths, especially from climate-related disasters, he is woefully incorrect. Now, this chart here is from the CRED International Disaster Database, and it shows the climate-related disaster deaths and how they've gone down since the 1920s to the year 2021. So in the 1920s, it was almost 500,000 deaths per year from climate-related disasters, floods, droughts, storms, wildfires, hurricanes, etc. So over the years, it's gone down and down and down. And now in 2021, they're estimating about, 7,000 deaths. That's a drop of more than 99%. Now, researchers such as Bjorn Lomborg and Michael Schellenberger have written extensively about this topic, and I highly recommend following them or reading their books. But as humans, as societies get wealthier, the deaths from climate go down drastically. That is to say, we're pretty good at adapting. Now, for further vindication, we can go to what's known as the IPCC, which is the Intergovernmental Panel on Climate Change, the leading authority on climate scenarios in the world. Now, this is a quote from an Atlantic article. The IPCC scientists expect that average life expectancy will continue to rise, that poverty and hunger rates will continue to decline, and that average incomes will go up in every single plausible future. And that includes futures where the climate doesn't increase to 1.5 degrees Celsius at all, or when it increases rather dramatically. Now I'm running a little bit over, so I'm just going to end with this. We can't let these kind of claims go uncontested. There is a whole world of literature out there that completely contradicts the narrative that they're building around climate change. And that's not to say that you're a climate denier. You can totally agree with the premise of climate change, and yet using the evidence that we have at our disposal come to totally different conclusions on what to do about that. And we should discuss this, we should debate this. We should not let them start imposing rules where there are no actual metrics for success that we can feasibly achieve. I'll put a couple of links to books down below if you guys want to read on climate change. It's really interesting stuff, and it's fascinating, all the literature we have and the knowledge we have on it. As always, I hope this leads to reasonable discussions in the future with your friends, coworkers, and families. So with that, thank you guys for listening. If you like it, please subscribe, please tell your friends. Let's get this channel growing. Have an excellent weekend and enjoy this video.